Hello friends. As you all are aware that currently the entire world is facing a threat of coronavirus infection. In this situation, the clinical and community pharmacy cell of our college, Principal K. M. Kundanani College of Pharmacy, which works under the umbrella of a renowned educational board HSNC, is always at the forefront to create awareness about health education and social welfare. This is yet another initiative taken by us to create an awareness about preventive measures to be taken to fight against COVID-19. You should know, World Health Organization WHO has declared official name for the new coronavirus disease as COVID-19. It is caused due to virus SARS-CoV-2. The symptoms of the disease include fever, dry cough, and difficulty in breathing. Let's understand the transmission of the COVID-19. Whenever an infected patient coughs or sneezes, the droplets spread into the air. If a healthy person inhales these droplets, he will acquire the infection. The second mode of transmission is a direct contact. If a healthy person comes in a physical contact with the infected person, like during the touch, his hand soiled with the infection may get transmitted to the healthy person and healthy person may get infected. The third is indirect contact. If a healthy person uses or touches the objects used by infected patient, he may acquire infection. Thus, to prevent and control COVID-19, what measures need to be taken? Restrict human to human transmission, control secondary infection, and prevent transmission. There are certain good hygienic practices which can also be followed. Wash your hands frequently, keep social distancing, avoid touching eyes, nose, and face, practice respiratory hygiene, update your knowledge, and follow the instructions by health professionals. Let's understand the first good practice. Wash your hands regularly. Regularly and thoroughly clean your hands with an alcohol-based hand rub which should contain at least 60% of alcohol, or wash them with soap and water. Wash your hands continuously at least for a period of 20 seconds. Washing your hands with soap and water or using alcohol-based hand rub will kill the viruses that may be there on your hands and hence will prevent the transmission. Now let's understand steps for washing hands properly. The step 1, wet your hands with running water. Step 2, apply enough soap to cover wet hands. Step 3, scrub all surfaces of the hand, including back of the hands, between the fingers and under nails for at least 20 seconds. Rinse thoroughly with running water and dry your hands with clean cloth or single-use towel. Second, keep social distancing. Social distancing is also called as a physical distancing. Means keeping the space between yourself and another person outside of your home. To practice social or physical distancing, maintain at least 1 meter, that is a 3 feet distance between yourself and anyone who is coughing or sneezing. Do not gather in groups and stay out of crowded places and avoid mass gatherings. Avoid touching to eyes, nose and mouth. Hands touch many surfaces and can pick up viruses. Once contaminated, hands can transfer the virus to your eyes, nose or mouth. From there, the virus can enter to your body and can make you sick. Then is a practice of a respiratory hygiene. As droplets spread virus, by following good respiratory hygiene, you can protect the people around you from transmission of COVID-19. Cover your mouth and nose with your bent elbow and tissue when you cough or sneeze. Always carry some tissue with you whenever you head out. Then dispose of the used tissue immediately at a safe place. After throwing away used tissues, you must always wash your hands with soap or use a sanitizer to wash away any dirt or germs. Regarding a mask management, wearing a protective mask or a scarf covering your mouth and nose as well as using gloves is mandatory in enclosed public spaces. Wearing a protection mask is also mandatory if you have a respiratory infection or care for a person with such infection. Place the mask carefully to cover mouth and nose and tie securely to minimize any gaps between the face and the mask. While in use, avoid touching the mask after removal or whenever you inadvertently touch a used mask. Clean hands by using an alcohol-based hand rub or soap and water if visibly soiled. Replace the mask with a new, clean, dry mask as soon as they become damp and humid. Do not reuse single-use masks. Discard single-use masks after each use and dispose of them immediately upon removal. Follow the instruction by the health professional. Stay home especially when you feel unwell. If you have a fever, cough and difficulty in the breathing, immediately seek medical attention. Calling in advance will allow your healthcare provider to quickly direct you to the right health facility. This will also protect you and help to prevent the spread of viruses and other infections. Follow the directions of your local health authority. Always remain updated with the current knowledge. Your national or the local public health authorities will have the most up-to-date information on spread of COVID-19 in your area. They are the best place to advise on what people in your area should do to protect themselves. Follow advice given by your national and local public health authority or your employer on how to protect yourself and the others from COVID-19. And always stay informed. What you should do if you experience fever, dry cough and difficulty in the breathing? If you have come in contact with a person infected with COVID-19, contact immediately on this number, which is of the Rajya Niyantran Kaksha, or contact this toll-free number 104 for enquiry. These are the references of our presentation. And the take-home message is, stay home, stay safe. Thank you.